Many people think that this is just a strength training exercise, but this exercise can actually be an amazing corrective exercise. The exercise can have completely different outcomes from how far your foot is, how high the bench is, and even where and how you choose to hold the weight. I want to start with the most important part that a lot of people neglect. It's the height of the bench. This is going to be where you're putting the resting leg, so how high it is absolutely matters. For most people, knee height or lower works best. If you have it too high, that can irritate the front or the back of the hip. And if the bench is too low, that can shift balance demands and put emphasis on the lower back. I've seen a lot of different setups for this exercise, but I always feel like it leaves a little bit of room for error. So here's a very simple way to get your right stance. Stand up against the bench and allow the back of your legs to touch. Stand straight up and don't lean against the bench. From here, you're gonna take a normal walking stride, just whatever your normal, like you're getting ready to take a step. You're gonna look at your foot, increase that step, just the length of your normal foot, which for me, right here. Put the weight on this leg and then bring this leg on top. If you have balance issues, don't bring it up on the toes like this. This is going to increase the demands for that. You're gonna put a majority of the weight on here. You're also gonna not lock the knee. You can either stay upright, which is going to put emphasis on the quads, or you could have a slight hip hinge and put emphasis on the glutes. I would also suggest doing this by a mirror at first, because you want to make sure when you're going down in the position that your lower back is not rounding. My favorite and most stable option is front loaded. Holding the weight in front shifts the center of mass forward. This is usually the best option for people with lower back sensitivity, pelvic instability, or anyone that tends to shift, turn, or lose control. A more advanced option would be to hold the weight on the same side as the working leg. This usually lets you load the leg a little heavier. This helps keep the ribs stacked over the pelvis, increases anterior core engagement, and it actually makes it easier to stay centered over the working leg. If someone already has pelvic instability, this is not the best choice to begin with. For some people, it can increase the demand too much, and they can compensate by hip hiking or shifting or even tightening up the lower back. This version is best for people that already have decent control and want to load a little bit more on the working leg. The most demanding is holding the weight on the opposite side. This is because it increases the demand on lateral hip stability and also anti-rotation control. It challenges the glute medius and also the deep core and even the ability to keep the pelvis from dropping. This is best as an advanced progression once someone knows how to stay perfectly level.